What up? What up? Friday in the house. Who's going to Vado after this, guys? Now we got those 2-day show going up. Be a fun one starting off. Coming out of hibernation. The diamond in the desert, baby. Be up there in the booth here in just a bit. Watch me teleport. But first, you already know. All right, welcome, esteemed viewers and cherished community to tonight's Know Your Pharmacist Livestream. I'm Dr. Joaquin Acosta, your guide and ally on this journey to demystify the intricate world of healthcare and wellness. Tonight, we delve into a story that touches the core of our hearts and calls for action. The tragic tale of Cole Schmicknett, a stark reminder for the urgency for pharmacy benefit manager reform. Our exploration isn't just a narrative, it's a catalyst for change, urging us to rethink how we navigate the labyrinth of healthcare bureaucracy to safeguard our well-being. In our Tech Talk, we take a leap into the future with drone soccer, a brilliant synthesis of sports, science, technology, and education. Witness how this innovative game is sculpting a path for young minds towards rewarding STEM careers, expanding their horizons beyond conventional boundaries. Our Enlightenment Hour is an odyssey into the realm of mental and physical resilience. Learn how deliberate cold exposure, a method dating back to ancient times, is being harnessed today for its astonishing health benefits. This segment is a tribute to the power of enduring discomfort to unlock unprecedented strength and focus. In the Herbal Wellness Corner, sponsored by High Horse Cannabis Company, we're breaking down myths. Tonight we scrutinize a groundbreaking federal report that redefines our understanding of THC levels and driving impairment. This revelation challenges long-held beliefs and paves the way for more informed, science-backed discussions on cannabis use and regulation. The community spotlight shines on the adrenaline-packed Vado Speedway Park's winter meltdown. Experience the rush, the thrill, and the raw power of this racing extravaganza. It's not just a race, it's a celebration of skill, speed, and the human spirit. And in our Men's Health Minute, we uncover the often overlooked ripple effects of men's health on society. Understanding this interconnectedness is key to fostering a healthier and more empathetic world. This evening, as we bridge the gap between knowledge and action, I invite you to engage, question, and grow with us. Let's embark on this educational odyssey, transforming our collective understanding of health and humanity. Remember, you're not just an audience, you're a vital part of this movement. Together, let's shape a future where health isn't just a privilege, but a right accessible to all. Stay tuned, stay enlightened, and let's form a healthier world together, all right? Jumping right on in. Okay, so, not sure if anybody's seen this story, but the PBMs just continue to break the entire country's heart. It is absolutely ruthless what's going on. So many different angles there, from putting independent pharmacies out of business down to, literally PBM abuse now killing people, and more obvious and preventable patient deaths are still going to be coming. They're here, literally. PBMs run a money printer on patient blood and pharmacy sweat. They're a scourge to be destroyed, and this entire story is why. The recent tragedy of a 22-year-old unable to afford a life-saving asthma inhaler highlights a grave issue in our healthcare system. This incident underscores the need for urgent reform in how pharmacy benefit managers and health insurance plans operate and cover essential medications. We must question the practices that prioritize profit over patients' lives and recognize the impact on community health and trust. It's crucial that we address these systemic flaws by advocating for policies that ensure medication affordability and accessibility for all. This is a call to employers, to insurance companies, and regulatory bodies to reevaluate their reliance on pharmacy benefit managers who work towards a healthcare system that prioritizes the well-being of its people over financial gain. So this young man, Cole Schmicknett, 22-year-old, living in Appleton, Wisconsin, loved video games and sports. His parents, Bill and Shannon, described him as an inspirational, free spirit with a love for being heard. He was definitely one of a kind. Cole was diagnosed with severe asthma at only a year old, and he had recently moved out on his own with the opportunity to chase his dreams until his life was cut short earlier this year. January 10th, he went to the pharmacy to get his prescription and was told it was no longer covered by his insurance. He was told there was no other alternative option and no generic drug would be covered. Cole didn't know how to respond and couldn't cover the extreme out-of-pocket cost of his Advair inhaler on a $19 an hour income. An inhaler-dependent patient left the Walgreens pharmacy with no medication. 5 days later, he suffered an extreme asthma attack and was taken to the hospital. He arrived at the emergency room lifeless and spent the next 6 days in the ICU on a ventilator. We were told he's never going to wake up again. A generic version of Advair only costs $15 to $20. What happened to Cole is happening all over the country, according to hometown pharmacy founder Dan Strauss. Unfortunately, we even see the state plan now no longer will cover for generic. They force people into the brand. Why? It's not hard to figure it out because it's the profit margin. Unfortunately, they're making people decide between life-saving medicine and paying bills, even though the cost of the actual item is so low, says Strauss. We find this absolutely wrong. It's infuriating and we should all be angry, and we hope to tell your legislators this needs to be addressed sooner than later, said Strauss. Hometown Pharmacy had to close a location in St. Germain partially due to the influence of PBMs. Pharmacy benefit manager acts as a middleman between drug manufacturers and pharmacies. In the last state legislative session, the pharmacy benefit manager regulation bill wasn't brought to a vote. The bill was designed to create transparency in a system and prohibit PBM's control over a pharmaceutical industry as a whole. We're very frustrated that it never got a chance to be voted upon, said Strauss. Strauss said there's a lot of speculation as to why the bill didn't make the floor. Cough, cough. In politics, there's a lot of moving parts, and we believe that the recent vote for Wisconsin is mapping a part of it because there's a lot of energy and focus with what the next election is going to be, and of course, elections are very expensive and you have to fund them. Strauss believes that money from lobbyist groups associated with PBMs have a strong influence on lawmakers. Of course, fortunately, it means that money and influence are a significant factor in us paying bills, especially ones that affect all the livelihoods of all of our health, said Strauss. Bill and Shannon said after learning of PBM's tactics that cost them their son, they were angry and decided it was time to speak up. I don't want you to ever have to imagine, I don't want anyone to ever have to experience this, said Shannon. Their goal is to share Cole's story and raise awareness. We feel just kind of like this is now our fight to fight for him. If we can prevent it for one other person, just that alone would be a little solace or a little something. I know we can never have our son back and he's gone, said Bill. Cole's situation is not the only one, and this could happen to anyone. Every day, life-saving medications are becoming inaccessible to patients who need them. We need our senators and our congressmen to help this process, and that's why they're there in the office for our complaints. Our concerns and our needs and the games that are played are just costing lives. So, terrible, heartbreaking story, guys. Hate to share this on a Friday afternoon, but geez Louise, PBMs. Burn in a special place. Sure believe. Anyways, let's move on to our tech talk. Moving on, Virginia Tech launching the U.S. drone soccer program in Northern Virginia. It's pretty cool. Anybody heard of the U.S. drone soccer? Anybody know like what on earth drone soccer even is? Well, I'll show you guys a little bit of a inside preview on this right now. So check us out.
Has a drone Academy of Mathematics and Science in Long Beach. The high school has a drone soccer team, and this weekend they will compete for a national title in New York. Now don't worry if you don't know what drone soccer is. We got you covered.
For somebody who has never seen this and they're watching TV and put this on and they're seeing these drones flying around, how would you best describe it to somebody?
It's kind of like Quidditch from Harry Potter. It's like a 5v5 game. One striker is scoring on each team. There's a goalie blocking the goal, and then the defenders are trying to help that goalie.
So drone soccer has its origins in South Korea. It was brought over to the U.S. a few years ago, and it's a new esport. It was an article about U.S. drone soccer. It kind of gave some history, but I was reading the article and there was a YouTube video link. It was the promotional video for U.S. drone soccer. So I watched it and I was absolutely amazed about what they were doing with the kids and how they were promoting equity and how they were saying that this was about helping kids with STEM skills. So I sent the video over to my principal. She watched it and immediately texted me back saying, how do we get this here at Vado?
Tell me the significance behind drone soccer and how this kind of works on parallel paths here.
There's a lot of STEM involved. The kids can build their own drones and program them and hopefully become an engineer.
I think a couple of us, we are looking into like pathways into aerospace and stuff like that. So Drones are kind of being used more in like the police force or like delivering food or packages and stuff like that. So if we can kind of get into that with drones and figure out how the drones work and how they fly and how to build them even.
I want to have a career in the STEM field, engineering, so building the drone was really fun for me. And I'd never really done anything with drones before this, so it was a really cool experience.
Here we go.
So now you can raise it up a little bit. Yeah, and then put your thumb on the controller, and you can move it around.
Oh, whoa, here we go.
Girls in STEM fields are underrepresented. And so one of the things that we're trying to do here, one of our focus areas, is to get more girls involved. And hopefully they will go into the workplace and represent, industry and represent people working in STEM fields.
So you guys have a big tournament coming up here in a couple of weeks. Tell me about the season and how you guys got to this point.
So we've been practicing since September, and we were in our first tournament a couple of weeks ago in Palm Springs. So that was their first time that they actually played against other teams, and they scored first, second, and third, and now they are going to the nationals.
I just hope that, we can successfully bring more people involved into drone soccer, because I do think it's the next big thing. It's an e-sport, full contact, and anybody can play it. You don't have to be, the biggest person on the team or be physically, like other athletes do. You're using more your head and other strategies, so it's a sport that's open to everyone.
If you're a web designer,
Cool, right? Basically, drone soccer, not sure if, New Mexico schools have this at all. Haven't quite seen that before, but, Virginia Tech and some of these other high schools that launching these STEM programs, definitely would love to see some, stuff like that going on here down south in the borderlands for sure. And let's keep moving on, guys. It's been a nasty day outside, and I don't know if this nasty day has prompted anyone to consider taking a hot shower or cold shower, but wanted to go over a little bit of benefits of cold exposure on a Friday afternoon. I know we all see a lot of, perhaps social media trends regarding cold plunges, things like that. However, there is some pretty decent backed science behind this stuff. Guys, I took probably 2 cold plunges in the last week. I did 3 minutes in 39-degree water today. It was pretty insane. I'm feeling pretty good. I like it. Interesting little change up for sure. However, definitely got to look at some of the science in and around it. So according to the Huberman Lab Podcast, he actually did, I like Dr. Andrew Huberman, what he did in terms of researching pretty much cold exposure and cold plunges, because there's a lot of data out there about it. And when you can go and get some of the top researchers, in those specific niches, you can actually get some really good answers, right? And so, he got boiled down to and I guess boiled is kind of the opposite word, he froze it down to, some of the science there, right? And anyways, so let's look. First of all, obviously safety, right? Be careful before you get into cold water immersion. You got to definitely work up to times. I definitely did 20 seconds my first time for sure. But let's kind of move past that, right? We're already assuming you're in the cold. If you have a cardiovascular condition or, a history of, familial cardiovascular problems, definitely consult your doctors before you choose to do anything like that, especially, putting some extreme stress on your body. Definitely want to check that out. But, the health benefits are absolutely there. And so how cold, right? Common question. However, you want it ideally pretty cold. The key is to aim for a temperature that evokes the thought, this is really cold and I want to get out, but I can safely stay in. For some, it could be 60 degrees Fahrenheit. Well, for others, it could be 45 degrees Fahrenheit. The key is the colder the stimulus, water immersion, cold shower, etc., the shorter amount of time you need to expose yourself to the cold. One study showed significant and prolonged increases in dopamine when people were in cool 60 degrees Fahrenheit water for about an hour up to their neck with just above the head above water. Other studies describe significant increases in epinephrine from just 20 seconds in very cold water, about 40 degrees Fahrenheit. The good news is that as you do deliberate cold exposure more often, of course, you'll be more comfortable in the cold, and at all times, you can start to use colder temperatures with more confidence, just like, for me, I am the ultimate, cold weather wimp, right? For sure. So, perhaps I was kind of curious about just obviously testing the mind and figuring out how to overcome things. And if I'm, so stressed out by just a little bit of cold, then what is life to me? And so for instance, I took some of that reflection in terms of my motivation for, looking at that. You guys look at it however you want. If you're an athlete, high performance, great. You just got some, inflammation, recovery, stress, basic vagus nerve reset that you're trying to look at, all different benefits that can happen, right? So anyways, ice cold bath, ice cold shower, or cryo. Most of the studies use ice bath or cold water immersion to the neck. They're the best, but cold showers, they can work and are accessible to most. Cryo, it's very expensive and harder to access and not subject to variation in protocol, so it's not considered here. So to increase energy and focus, deliberate cold exposure causes a significant release in epinephrine, aka adrenaline, and norepinephrine, aka noradrenaline, in the brain and body. These neurochemicals make us feel alert and can make us feel agitated and as if we need to move more vocal on the cold exposure. Cold causes their levels to stay elevated for some time, and their ongoing effect after the exposure is to increase your level of energy, focus, which can be applied to other mental and or physical activities. Another thing is building resilience and grit. By forcing yourself to embrace the stress of cold exposure as a meaningful self-directed challenge, aka stressor, you exert what's called top-down control over deeper brain centers that regulate reflective states. This top-down control process involves prefrontal cortex, an area in your brain involved in planning and suppressing impulsivity. That top-down control is the basis of what people refer to when they talk about resilience and grit. It's a skill that carries over into situations outside of the deliberate cold environment, allowing you to cope better and maintain a calm and clear mind when confronted with real-world stressors. In other words, deliberate cold exposure is great training for the mind. Who would have thought, right? Also, enhancing your mood. While not true of every stress, cold exposure causes the prolonged release of dopamine. Dopamine, powerful molecule capable of elevating mood, enhancing focus, attention, and goal-directed behavior. Even short bouts of cold exposure can cause a lasting increase in dopamine and sustained elevation of mood, energy, and focus. Metabolism. In the short term, cold exposure increases metabolism as the body has to burn calories to increase core temperature. The total calories burned from cold exposure are not that significant. However, the conversion of white fat, energy storage, to beige or brown fat, which are highly metabolically active, can be beneficial for one, allowing people to feel more comfortable in the cold, aka cold adaptation, and two, triggering further and more sustained increases in metabolism. Of course, calories in, consumed versus calories out, metabolizes, or KICO, governs whether you gain, lose, or maintain weight. There's no escaping the laws of thermodynamics, right? So a solid, basic, science-supported protocol. This is, where I would say, hey, thanks, Dr. Huberman, for boiling this one down for the rest of the country, because there's all kinds of memes, all kinds of things going on when you're thinking about cold exposure and you're like, well, what do I actually do, right? And it doesn't necessarily, you can go deep into the studies and then you're looking at what studies. And so just like anything else, it's nice to be able to see where, science is really supported. So here, consider doing deliberate cold exposure for 11 minutes per week total, not per session, but rather 2 to 4 sessions lasting 1 to 5 minutes each, distributed across the week. Again, the water temperature should be uncomfortably cold, yet safe to stay in for a few minutes. You can do more, but this should be the minimum to achieve the benefits of cold exposure. You can do very cold, very brief exposures for adrenaline release too, but the 11 minutes is based on a recent study that explored a range of effects as a good, solid, basic protocol for ongoing use. They looked at not only saunas, right? They said after about half an hour in the sauna, you don't get any other significant health benefits. Same goes with this 11 minutes per week total, like not 11 minutes at once, right? It's actually scattered throughout that week. Those, incremental bursts are what are really, doing that positive effect. So, the Huberman Lab calls it counting walls approach, right? Undoubtedly, during or before cold exposure, you will find your mind pushing back against the challenge. Your mind will say, man, I don't really want to do this. Even before getting in, get me out of here. You can imagine those mental barriers as walls. These walls are in fact the effects of adrenaline pulses in your brain and body, which in this case is what triggers eventual adaptive response. After all, if it were easy, then there is no stimulus for your body to change, right? By maintaining top-down control of your reflexive urge to exit the cold environment, you will have successfully traversed the wall. Challenge yourself by counting walls and setting a goal of walls to traverse, aka 3 to 5 walls during the round of exposure, right? Every time you want to get out, suck it up, get past it, you climb the wall, right? You can also go in for time, up to you. The advantage of the walls approach is that it carries over to other scenarios more seamlessly, as most of life's stressors don't lend themselves so well to merely timing the duration it passes. It also enhances your sense of mind-body connection to do it that way. So, shivering in the Soberg principle, right? Based on deliberate cold research, Susanna Soberg, is to enhance the metabolic effects of the cold, force your body to reheat on its own, or end with cold. So, allowing your body to shiver may enhance metabolic uses from the cold. Shivering causes the release of succinate from the muscles and further activates brown fat thermogenesis. Try this protocol to increase shivering either during or immediately after cold exposure. Don't huddle or cross your arms while in the cold or after getting out. And also don't towel off. Let your body reheat and dry off naturally. Admittedly though, that's tough, right? Especially after you made it right out. Unless doing deliberate cold exposure on a hot sunny day. Admittedly, I prefer to take a hot shower and towel dry after the cold exposure, but I am no doubt limiting the metabolic effect by doing that. And that's per Dr. Andrew Huberman himself. You know, Wim Hof method of breathing, cold plunge, that's another way to really kind of dial in the breath, the body temperature, you know, and the focus as well. And, you know, when you really start combining all that stuff, it's pretty interesting science, right? So anyways, physical recovery, a meta-analysis of cold water immersion effects on recovery found that cold exposure can be a highly effective recovery tool. After high-intensity exercise or endurance training, short interval, less than 5 minutes, cold water immersion demonstrated positive outcomes for muscle power, perceived recovery, and decreased muscle soreness, in part to a reduction in circulating creatine kinases. The problem is that cold water immersion, but not cold showers, can limit some of the gains in hypertrophy, strength, or endurance if done in the 4 hours or so after training. It's better to wait 6 or more hours until after training, or do it before training unless your goal is to simply recover without adaptation. For instance, when in a competition mode and not trying to get better, stronger, etc. Day or night? Question there. How about that? After cold exposure, your body heats up. Yes, heats up for the reasons discussed on the podcast, right? And you guys highly recommend dialing in on YouTube or whatever, Huberman Lab, cold exposure, watch the whole thing, you know, watch the main clip, whatever you got to do, right? But this is the essence of it all. Body temperature increases tend to wake us up, whereas body temperature decreases tend to shift us towards sleepy states. Thus, suggested to use deliberate cold early in the day and not too close to bedtime. Sometimes it's better to do it better late than never, but not if it perturbs your sleep. If deliberate cold affects your sleep, try doing it earlier in the day or even not at all. So, increasing resilience, enhancing the effect of deliberate cold exposure. Staying completely still while in the water allows a thermal layer to surround your body, insulating you from the cold. To be most effective as a resilience tool, move your limbs while keeping your hands and feet in the water. That'll break up the thermal layer and you'll experience the water as much colder than if you stayed still. You know, anybody's a sucker for pain, right? This is also a good way to increase the potency of a cold stimulus without having to make the water colder. This is akin to slowing down the movement of a weight lift to reduce your momentum and provide more tension on working muscles. So, you know, anybody that's seen the memes, seen Joe Rogan, you know, in the cold tub in his backyard, I know that's absolutely one of my favorite memes, and I'm just gonna, you know, gotta shout out the GOAT. You know, people kind of give him some flack for this one. So you know, shout out to Joe Rogan and his little biohacking situation. But man, this video, it cracks me up, right? He makes some pretty funny faces in there. You know, his mammalian glands on his chest are quite hilarious as well. But anyways, shout out to the GOAT Joe Rogan on that. Give him some love there for sure. All right, so let's jump out of the cold exposure. If you guys want a little cold exposure, I dare you to come out to Vado Speedway Park this weekend. It won't be cold for long when those engines start revving. Good gosh, I'm ready to get out there. So guys, let's, you know, move on to another relevant segment here. An interesting one coming out of cannabis.net. Check it out. The amount of THC in your system does not determine impairment when driving, says new federal government report, right? So interesting enough, you know, we see a lot of crisscross data on this, but this one, the Fed's admitting that the level of THC system in your system is not quite a good indicator of impairment while driving. You know, when it comes to stoner culture, there's an unwritten understanding that reverberates through the smoke-filled rooms of seasoned stoners. The presence of THC in your system is not a definitive marker of impairment. This nuanced perspective born out of the countless personal experiences and observations contrasts sharply with the blunt instrument approach adopted by law enforcement agencies across the nation. For years, the legal threshold of THC content in one's bloodstream has been wielded like a gavel, ready to pronounce judgment on one's ability to operate a vehicle safety. But the science behind this method of assessment is far from settled, and voices from within the very institutions that have forced these rules are beginning to even question their validity. Enter the arena a researcher from the Justice Department who recently cast a spotlight on the glaring discrepancies between THC levels and actual impairment, especially among those who consume cannabis regularly. This acknowledgement from a federal figure and a federal agency marks a significant pivot in the conversation around cannabis, driving, and the law. However, we've had federal judges make comments which impacted absolutely nothing, save for a few cannabis people that say, hey, look, the feds agree, right? Nonetheless, it's a recognition that the current metrics might not just be flawed, but could be fundamentally misaligned with the realities of cannabis consumption and its effects on the human body. The implications of the critique extend far beyond legal skirmishes on the roadside. They touch on the very heart of how society understands, regulates, and integrates cannabis use within the framework of daily life. So the article dives deep into the murky waters of THC impairment while driving. So what did the researchers say, right? Recent Justice Department said, states may need to get away from per se THC limits for determining cannabis impairment while driving. We already know people have been incarcerated for way too many terrible reasons when it comes to cannabis. And interesting that at least there's a small Justice Department, department within a department that is perhaps a little bit more enlightened than the rest, right? So anyways, the problem is we funded this research that pretty conclusively shows that THC concentration in the blood is not particularly well correlated with impairment for driving, says Francis Scott, a DO Justice physical scientist, on a recent podcast. Maybe what we need to do is kind of get away from the idea that we can sort of have a number when it comes to cannabis and have that mean that you're impaired. One major issue is that frequent and infrequent cannabis users metabolize THC differently. You have chronic users versus infrequent users. They have very different concentrations correlated to different effects, Scott explained. So the same effect level, if you will be correlated with a very different concentration of THC in the blood of a chronic user versus an infrequent user. A recent study funded by the federal government identified new methods to test for recent cannabis use that accounts for lingering THC metabolites. But we still lack a good metric for impairment. With alcohol, we per se laws, that's the 0.08 blood alcohol content, said Scott. If we demonstrate that your blood alcohol content is over 0.08, that's all I have to do to prove impairment, but THC is more complex. Maybe it's not a blood measure or a breath measure. While the Justice Department continues researching the cannabis breathalyzer, they're also funding alternative tests like saliva swabs and assessments of eye functioning. Some research has found little link between THC blood levels and crash risk. 2019 study concluded that drivers at the legal limit of the 2 to 5 nanograms per milliliter were no more likely to crash than sober drivers, and a congressional research service found that conflicting results on crashes and THC levels, both in 2019. With unclear science, lawmakers want clarity. A House 2022 House bill supported developing an objective standard for cannabis impairment. Senator John Hickenlooper requested an update on research barriers inhibiting standardized cannabis impairment tests, but the path forward remains unclear. We need better tests, said Scott. Until then, per se, THC limits seem unreliable for determining driver impairment. So, at the end of the day, very interesting conversation to have, for sure, and absolutely, guys. By no means am I encouraging, THC use and driving and endorsing these things, but I do endorse, the wrongful incarceration for people with cannabis, especially when you perhaps have not quite very good reasons and understanding behind it, very much due to the fact that cannabis has been federally illegal for the past 100+ years, and research on it has continued to be limited because of such. Anyways, guys, hope everybody's shopping high horse for the weekend. Got all the best deals scrolling on the bottom of the screen if you want to check it, but just scan this link and you'll see all our March Madness discounts there, baby. And go shop. Our dime pens right now are absolutely flying off the shelf. I highly encourage you to try them. Not only are their batteries and their mechanisms pretty advanced, right? But high quality products. So let's move on. Community Spotlight brought to you by the Baked Chicken Farm, a neighbor to Vado Speedway Park, guys. So we're shouting out neighbors over there. Guess where we're going to be? At Vado, baby. So get those tickets. We'll see you this weekend. Tonight, races start at 7:30. Tomorrow, races start at 7:30. I think grandstands open at 5, 4. Get there by 5. You're totally clear. You're 2.5 hours early if you're a race fan, right? And if, you got nothing to do all night long, then just enjoy it. Enjoy the revving of the engines, man. It is something like no other. That vibration there, wakes me up in all the best ways. So get those tickets. We'll see you guys out there. We're excited to see some absolutely great modified drivers. Legends are back out, ready to go, ready to whip it and rip it. Stock cars. So ready to see all our Vado peeps reconnect. Beef up that social connectivity. That's something in our Men's Health Minute brought to you by Vado Speedway Park. We love to absolutely endorse Men's Health and, getting out there, hanging out with your friends, being social. It's really, really good for the health. Really, really good for a lot of different things, right? And anyways, lastly, in our Men's Health Minute tonight, we're just talking about men's health, impact on women, children, and society, and just, considering, right, ripple effects, right? Men's health, often considered unimportant to the well-being of other demographic groups. However, the challenges may impact the health status of women and children profoundly, impairing family health, economics, and the stability of relationships. Society is adversely affected economically by preventable male illness and death through lost time of work, disability, and diminished work productivity. Widowed women commonly experience financial hardship and increased death rates. Fathers' age, alcohol and tobacco use, and military exposures are associated with specific birth defects in children. Infectious diseases such as human immunodeficiency virus, right? HIV, herpes simplex virus, HSV, human papillomavirus, HPV, and chlamydia among men are readily transmissible to women through sex, often with significant consequences for women and children. Males as a group are less likely to utilize preventative health care, less likely to have health insurance, and less likely to have seen a physician in the previous year than women. Studies show that many men do not respond to pain and illness by seeking health care. There's a pervasive lack of self-awareness concerning men's health issues, and men's work hours frequently eclipse the hours when health care is typically available. Depression in men is likely under-recognized significantly, given a male suicide rate 4 times higher than that for women. Men's health is vital but neglected component of community health. A tetrad approach is necessary to optimize public health outcomes, including children's health, women's health, and minority health as co-equal partners. So, right, addressing the needs of male would very likely lead to overall improved health outcomes for communities and nations. And we talked about this in many different ways, right? But for those of you listening, even if you're not a man, understand, the men in your life, the sicker they get, the less they go to the doctor, the less they're doing preventative health care, the more eventually it's going to come and catch up to the whole unit, right? So, of course, mild positive encouragement to just recognize those things, right? Find a way to get some care. If it's not always, some entirely expensive thing that we frame it out to be in our minds, and there's, ways to not entirely circumvent the system, but there's definitely ways to get access to the right healthcare or the right, healthcare tests or labs or whatever that may be to make sure that, everything is running smooth, and then empowering you to go and take back your health, right? It's not just about, using alcohol, using cannabis or anything like that to self-treat. Although, everybody, man or woman, should absolutely have their own autonomy to treat their health as such. But I think, in the at least semi-competitive world of monkey see, monkey do, some guys are living longer than others. Then some guys you would imagine want the secret to how to live longer. Go to your doctors, take care of yourselves, right? And I know it's really easy to make those excuses when you can't, quite do those things during the working hours or these things, but telehealth, telemedicine, access on the weekends, things like that are way, way more, truly accessible here in 2024. And so again, if you ever need help for resources, hit me up. I got you. We'll take care of it. But other than that, I am going to be raising my blood pressure at Vado Speedway Park, yelling at the mic, and I'm ready to go, baby. So we'll see you guys there. And have a great weekend. Let's go racing.